Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls all hour at 866-870-5752. And remember, when you phone, you get the free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy. Regenerate, Don't Operate is the subtitle, with 264 scientific studies. And right now we are speaking with Chris.
Hey, Chris, Dr. Marc Darrow, thank you for calling in. Before I get to all your issues, I want to just talk about the basis of what our show is. It's called Living Pain-Free, and it's the byline that I use is take the surgery out of pain, which is leave the surgery for the last possibility if you have to do it and it's an emergency. Most of the surgeries that are done for orthopedics, in my personal opinion, should never be done. There are ways to heal now using cells from your own body called platelets. That's called PRP, platelet-rich plasma. Or we can use your bone marrow, which has platelets and stem cells in it. Or in the newer thing on the block is umbilical cord stem cells, which come from a healthy, brand new birth. And it's not about abortions. We don't kill babies. And we use just the umbilical cord from a healthy mom, healthy baby, which is donated to the hospital. And the stem cells come from there. It's a lot easier for the patient to use the umbilical cord stem cells than it is to have their pelvis drilled to get the bone marrow. Either way is not a big deal. It literally, once the area is numbed up for the bone marrow, it takes me about 15 seconds to do the procedure. I've done so many thousands of them. But it's easier for the patient not to get drilled at all. And the study we're doing a huge study. It's going to shake regenerative medicine that shows that the umbilical cord stem cells work just as good as the bone marrow. And I know there's going to be a lot of people screaming at me when that study comes out because they make their living just selling bone marrow procedures, and they don't like the idea of using umbilical cord. They say they're not even alive. So I don't know the answers to everything. I just know that we have a 20-person research team at my office doing research on all the procedures we do. We're tracking thousands of patients and getting great results with most of them. My procedures don't help everybody, but there's a lot of reasons for that. We have to choose the patient wisely, and we have to make sure the patient complies with what I ask them to do, because a lot of patients continue doing their exercises and beating up the area after they're in the healing mode, and it doesn't work. There's a lot of reasons. A lot of people quit too soon when they could have healed. So back to your issue, you have some degenerative disc disease that was shown on an x-ray. That means the disc is drying out. And you're 59. This has been bothering you since you're 18. You use a sort of a teeter-totter to decompress your back when you have pain, and that helps you. Be careful using that. Some people, if they flip upside down, they can stroke. And if there's no one there to help you, to right you up, you could actually die from that. So those devices can be good, but there should be a governor on it so you don't flip upside down. A lot of people in the old days used to hang by their feet on a chin-up bar. I don't know if you remember that. That's very dangerous. So I'm glad that you have something that can help you. It seems to me what you're talking about is just the ligaments are getting stretched out. And when you have that condition, we can thicken them up by about 200 to 400%. So there are studies on that also. And you would probably be a prime candidate for getting platelet-rich plasma. We would just draw your blood, spin it, and throw away the red cells that are irritating and just inject the platelets into the ligaments in your lower back. And that's something we do every day of the week. And it's an easy procedure. You walk in and you walk out. Do you have any more questions about that, Chris?
Do it. I will. I will, promise. Yeah, I just have to do it once in a while, but it's just gotten worse.
I got all that. I heard you, but do you have any more questions about it? Nita, we're going to take this off of the radio because there's a lot of background
Yeah, we have
noise
interference
for
on
Chris.
your line there, Chris. So I'm
Chris,
really
God
sorry.
bless you, and thank you so much for calling. We're going to go to Margaret.
We are indeed, Margaret.
But first, we're going to give out our phone number for other callers to call in. I'll let you do it, Nita.
Thank you so much. Our number is 866-870-5752. That's 866-870-5752. And we have Margaret.
Hey, Margaret, Dr. Marc Darrow, you're having knee pain. How long has it been there?
Oh, for a long time. I had one knee replacement, and every time I go to the doctors, they want to replace the other, and I don't want to do that.
Okay.
I'm willing to trade pain for walking better. Is there any way you can help me? I'm old.
You're not old. How old are you?
83.
Okay. You're a spring chicken these days.
Oh, my God, thanks.
My mom made it.
Hard. I want to
My
walk
mom made
again
it to
better than
102.
I am.
You're going to probably live a very long time. Everybody's living longer now. Have you noticed the kids are getting taller? Everything is changing.
Yes.
I don't know what's going on. It could be the hormones in the food. I don't know what it is, but
That's the
people are.
California sun, I think.
It could be that too. Anyway, are you able to bend your knee?
Yes.
Okay. If you can bend
I
your
walk.
knee. All right. So you're in good shape. Yeah. We can probably help you quite a bit, either using PRP, platelet-rich plasma, just drawing your blood and spinning it and taking the platelets out and injecting them into your knee. I use an ultrasound to guide the needle. Don't ever get any injections in your shoulder, your knees, your hips without an ultrasound guidance, because the solution's not going where it's supposed to go. You can't see inside the joint. I used to do it that way. I didn't get as good as results as I have using ultrasound. I have 3 ultrasounds in my office, and we run them from room to room. And as an example, if you have fluid in your knee, which you're probably going to, with the ultrasound, I can see every drop of it. I don't need to just poke around in the dark and bang the cartilage and scrape it. I can stay away from all the tissue that we don't want the needle hitting. If you get a shot without the ultrasound, damage is actually being done. So be careful. Make sure whatever your doctor is, if he's injecting your knees, your shoulders,
he
your
injected
hips.
what is that, rooster cone stuff?
Did he use an ultrasound? Did
I
he
think he did.
Well, that's good.
Yes.
The only thing is there's studies that show when you use the hyaluronic acid, it actually causes more damage in the long run.
Yeah, well, my knee was stiff after that.
It does not grow back tissue. And what we want to do is regenerate the area and grow back the tissue to heal you. We do not want a knife going in there and cutting tissue out. We do not want an amputation and then putting in fake parts of metal and plastic. That has all kinds of problems with it. And I would come on in. Our phone number at the office is 800-300-9300. I'll repeat it, 800-300-9300. And there are people by the phones. You can call up and see if we take your insurance. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare. And if you don't have insurance, we can help you get Care Credit, which is like a credit card for medical insurance. Okay. Nita, we're going to move on to...
Okay, thank you so much for your call,
thanks.
Margaret.
God bless
we
you,
appreciate
Margaret.
It.
Yeah.
Okay, our number is 866-870-5752, and we're going to Patty in Cyprus.
Patty, I'm so glad you called because, by the way, this is Dr. Marc Darrow, because someone told you have bone... I can hear you, but you just cut me off, so that means you can't hear me. Can you hear me?
I can hear you.
All right, great. So you were told that you have bone on bone in your knee, and I doubt very highly that you have that. Can you bend your knee, Patty?
Yes, and I walk. I'm just like the lady you just called.
Okay, good. Well, that means you don't have bone on bone. It means there's still a little slippery cartilage in there to allow you to bend the knee. And I don't like it when doctors say bone on bone, because they're implanting a negative inside of you, which is that your knee or whatever joint it is destroyed and you have to have it replaced. And in most cases, that is not true. If you're walking and you can bend your knee, there is a very high success rate if we inject you with platelets or with stem cells or both, that you're going to get better. What questions do you have of me, Patty?
About it, but the other question I had, which is probably worse than the knee, is my back.
Okay.
I have, the last time I had an x-ray, and I've had epidurals, they said I had spondylosis.
I'm sorry, what is it? Oh, spondylosis. Yeah.
Very bad, and he put me in therapy. I did that. I've done therapy. I've done acupuncture. I was told I should have surgery 25 years ago, but I would never do it. So all it's doing is getting worse.
Well, Patty, you're a smart woman. Let me go over a few things that you mentioned. Spondylosis is something that just about everybody gets as they age. If you saw an MRI of my neck and back, you'd wonder how I move. Well, guess what? Right after this show, I'm going to go play golf. What does that tell you? Don't believe your MRI or your X-ray. Well, come on out with me. I'll take you. But my point is this.
I stopped playing golf quite a while ago.
Okay. My point is this. Patty, listen, please. My point is that it doesn't matter what your X-ray shows. It doesn't matter that your doctor told you have bone on bone in your knee. It doesn't matter that you have spondylosis. That doesn't mean you have pain. Most of the pain you're having can be fixed. It can be fixed by just injections with regenerative medicine, using cells, either platelets from your body, bone marrow with stem cells, or umbilical cord stem cells mixed with PRP. So I'm going to give you the office number. You can call in, see if we take your insurance. It's 800-300-9300, 800-300-9300. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, and United Healthcare, but not all of those policies pay for you coming in. So you have to call up and get an insurance verification, okay?
Yeah, well, I can hardly get out of bed in the morning, so I'm anxious to try something.
No, there's good hope, Patty. Nita, we're going to move on to Mike.
Thank you, Patty, for your call.
God bless you, Patty. We appreciate it. Thank you.
Okay, let's go to Mike.
Hey, Mike, Dr. Marc Darrow, you have a hernia problem, and where is it? In the groin you're talking about?
Hey,
This
Mike.
is for another person that I know, not directly for me. Yes, they had that some time ago, and they took the mesh out, and I don't know exactly what happened to all the different structures that they tore up or something. I think they had surgery that it didn't work right. So I just wonder if you could do anything on that.
It depends where the hernia is, but generally I don't work with hernias. I deal with musculoskeletal pain, joints, ligaments, tendons, arthritis, things of that nature. So I apologize, and we're going to have to move on to the next caller.
Okay, just send me the booklet that you have.
We will do that. I will send you the book, and you're going to love it.
Thank you, Mike, for your call. We appreciate it. Okay, here we go to Torrance in La Mirada. Okay, hi. Are you with us?
Torrance, is that your name?
Yes, ma'am. How are you?
I'm living it up, man. My name is Marc, Dr. Marc Darrow. So I get confused. Is your name Torrance and you live in La Mirada, or is your name La Mirada and you live in Torrance?
Either way is fine. No, it's actually Torrance. I live in La Mirada.
Anyway, it says here on the call screening board that you have pain in your left eye, and I don't deal with eyes. I'm not an eye doc.
Just with the last caller. So.
Do you have any musculoskeletal pain, knees, shoulders, hips, backs, neck, stuff like that?
No, none whatsoever. I'm a fairly young guy, and I was just recently diagnosed with the scleritis, and it's been driving me crazy. So I was just trying to call in and see if there's any tips or hints I can use to kind of alleviate.
I'll tell you what you do. Yes, I do have some tips. I'm not going to talk about them on the radio. But if you want to go to my website, which is www.lastemcells.com, you can email me. Every page has a spot to email me. Tell me we talked on the radio, and I'll shoot you back an email of what is possible to help you, okay?
All right, perfect. Thank you.
God bless
Thanks
you,
for your
man.
call,
Appreciate
Torrance.
your call.
Our number is 866-870-5752. This is Living Pain-Free with Dr. Marc Darrow. This is where we talk about musculoskeletal pain, like your hip pain, your back pain, your arthritis pain, and stiff joints, dull aches, basically orthopedics. And when you phone the program today, you do get a free book called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies, and you really want to read this. It's Dr. Darrow's latest book. So that's how you get the book. You call and you talk to us. 866-870-5752 is the number. That's 866-870-5752. There's still a little time left, so give us a call. And you can also go to Dr. Darrow's website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on that site and see him performing the treatments on video, which is a real cool thing. If you're visual and you want to see what that looks like, then you can do that. That's lastemcells.com. And we're going right to Vivian in Inglewood.
Hey, Vivian, Dr. Marc Darrow. Before we get to your question, I've got another question that I want to do here real quick.
Sure.
And you'll learn from this too. This is a question that just came in. And the phone number is 641, which is Iowa. And the person says, my husband had stem cells 18 months ago on his knees and shoulders, but it didn't seem to work that well. Can he go back to cortisone shots? He can do whatever he wants, but that's not going to help him. That'll make it worse. And the fact that he had stem cells one time is problematic. Because it burns me up when you read websites or you hear doctors say, just come in, you get one stem cell, and it's going to fix it. What do they think it is? Magic? It's not. It just makes sense. But oftentimes it takes more than one treatment. Are there people that do heal with one stem cell treatment? Yes, and there's many where it takes a series. Stay away from the cortisone, okay? And now we are going to go to Vivian. You have knee pain, Vivian. How long has it bothered you?
I've been having issues with my left knee for about 2.5 years.
Okay.
And I've been going to the doctor and getting Synovis. It's like a gel that they put in there.
Yeah, that's called hyaluronic acid. It's a lubricant.
Yeah, so I started off with those, and then it was getting worse. I mean, it would wear off after about 6 months or 8 months, whatever. I'd go get another one. Then he gave me a cortisone shot. So I have cortisone and the other one, but I still limp and I still have pain. It's
Okay.
not, I'm still limping, and I'm 60 years old, and it affects my gait
Okay.
and my life.
I hear you. So here's some answers to your questions. The Synvisc doesn't help you. Actually, studies on hyaluronic acid show that it actually increases arthritis. And sure, it can feel good for a while. Then it's reabsorbed in the body. Most knees that are problematic don't need a lubricant. Most of them actually have hyaluronic acid in there already. And the fact that you had a cortisone shot after that is problematic because that softens the cartilage and eats it up. So neither of those things are things that I do in my office. If you were to come in and see me, I'm going to talk you into, if you want to, doing regenerative medicine. It just makes all the sense in the world. And if you're going to get a copy of my book on stem cells and platelets, just for calling in today, you'll get a copy for free. And you'll read about all the studies in here that show that the surgeries don't do any good and the regenerative medicine does a lot of good. So why would people do these other things when it makes no sense? I have no idea other than it's the culture of surgery. That culture is on its way out, and regenerative medicine is on its way in. I know so many surgeons now who are doing less and less surgery. Some have even quit doing surgery to do regenerative medicine. I was trained in surgery, and I was really into it until I had a surgery on my right shoulder that really screwed it up. I then learned about regenerative medicine. I injected my own shoulder, and it was healed the very next morning. I don't want to give you the idea that things heal that quickly, but it did for me. I've done my wrist, I've done my shoulders, both of them. I've done both my knees. I've had other people do my neck and back. I've done my elbows. I've had very, very good success on all of these areas. So that's the story. That's what I would think about if I were you, Vivian.
No, I'd definitely like to make an appointment to go see you, because with this quality of life, I was thinking of getting possibly or inquiring about the knee replacement.
No, don't even think about that. Do you know the problems that come after knee replacements? I know a lot of people have it done, and they'll come back in and go, look, ha, 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 it worked. And then they come back a year later and they're infected or something, or it wears out. I mean, it's just not a great thing to do invasive medicine on anybody. If you can do it conservatively, always do conservative medicine.
Okay, well, I'm definitely going to make an appointment with you, because I have a trip planned for December 2nd to go to Israel. It's a lifetime dream trip for me, and I'm just saying I have to have my knee in a state, or at least even with the bandage up or a brace, I can go on that 10-day trip.
Well, God bless. I hope you get there.
Thank you, and I'll definitely hold on and talk to your screener and get your information so I can
Yeah,
go in and see
I would just call the office right now and get an insurance verification. We do take Medicare, Cigna, and the Blue Cross Blue Shield, United Healthcare, and that's 800-300-9300. It should hopefully at least pay for your first visit to see if you're a good candidate.
Okay, yeah, I'll definitely see you in the office. I have the PPO insurance, so it's not an issue.
Okay, good.
And I appreciate your taking the time to help me out.
Thank you,
Thank you, Vivian.
Appreciate
I'm looking forward to meeting you. God bless you.
Okay, let's see what's going on with Dawn in Cyprus.
Hey, Don, Dr. Marc Darrow, I understand that your wife has degenerative disc disease. How long has that bothered her?
She started feeling symptoms about a week ago, and then Sunday she was in excruciating pain in her lower right abdomen, went to emergency. They administered morphine, took a CT scan, gave her some Norco, sent her home. Monday, same thing happened.
Oh, gosh, I'm so sorry, Don. So sorry.
Get to the website, www.lastemcells.com, lastemcells.com. Email me, and I'll get right back to you about your wife, okay?
Okay, thanks, Dr. Darrow. Thank you, Alex. Thank you, Nix, and everyone here. And thank you, callers. And remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens, and we'll see you next time.